leaders who will help us reduce health equities, health inequities, improve health, increase healthcare access, and reduce healthcare costs. There are numerous problems to address, but I know that they are well prepared thanks to our excellent faculty and community partners. So I am honored to open this year's UPD ceremony and to hear about the accomplishments of this future healthcare leader cohort. So now I'm going to turn it over to Dr. Elena Platonova, the faculty advisor for UPD.
Thank you, Jen. As I was introduced, I'm Elena Platonova. I'm an associate professor of healthcare management and faculty advisor for the UNC Charlotte UPD chapter. Upsilon Phi Delta, or UPD, is a derived word from the Greek language for health, service, and leadership. The organization was established in 1965 to further the profession of health administration and the professional competence and dedication of its members. The society is administered by the Association of University Programs in Health Administration, AUPHA. The UNC graduate chapter of Upsilon Phi Delta was established in 2010. Membership in the chapter is based on academic excellence, high professional standards, and ethics. Members are selected based on academic achievements, service to the MHA program, and or contributions to the healthcare management profession. First, we are introducing MHA students who have demonstrated academic excellence and leadership qualities in health care management. Ms. Amanda Dees, UPD Advisory Council President, will introduce MHA student inductees. After the students are presented, all of them are presented, they will be given a minute to share their aspirations for the future. After that, Amanda will introduce alumni inductees. Alumni inductees will be given a minute to share their professional experiences and aspirations. And with that, I'm giving the podium to Miss Amanda Dees, UPD Council President.
Thank you, Dr. Planova. Okay, so like you said, I'm going to start with the graduate student inductees. And first is Allison Hamil. Okay, she received a Bachelor of Science in Public Health at UNC Charlotte in 2019, where she also began the MHA program as an early entry student. Allison completed an internship with Gate Pregnancy Resource Center during her undergraduate studies. She completed an internship in the graduate program with Levine Cancer Institute at Atrium Health. Allison is interested in patient outcomes and adverse effects. After receiving an MHA in May 2021, Allison plans to work in human resources or quality control. Okay, next I have Sunenya Kirpalani, received a Bachelor of Arts degree in Biology and Linguistics with a minor in Cognitive Science from the University of North Carolina at Chapel Hill in 2016. Sunenya has worked in healthcare since 2013, where she went to Nicaragua to provide free care for residents of native villagers in the Nicaraguan jungles. While studying at UNC Chapel Hill, she acquired an emergency medical technician license. She has been a medical assistant at Carolina Asthma and Allergy Center 2016 to present. In 2020, Sunenya completed an internship in a trauma services department at Atrium Health's Carolina Medical Center, where she focused on data analysis, trauma research, and social media outreach. After receiving an MHA in May 2021, Sunenya plans to work in hospital management and to continue to give back to the community. Okay, Nikki Layden graduated with a Bachelor of Science in Community and Global Public Health from the University of North Carolina at Wilmington with a minor in nonprofit management and leadership. Nikki has worked at multiple healthcare systems and nonprofit organizations, gaining skills in quality improvement, development, fundraising, and operations. She is a certified Lean Six Sigma Green Belt. After receiving an MHA from UNC Charlotte in May of 2021, her professional goal is to work in a healthcare setting, increasing access to healthcare for underserved populations, while also improving quality of care for patients. Justine Leon graduated from Davidson College with a bachelor's degree in public health. She has been a member of the Charlotte Healthcare Executives Organization and currently serves as treasurer on the executive board. Justine also works as a graduate assistant and as a teaching assistant in the accounting and finance for undergraduate students in the BS in Health Systems Management program. Justine is also a second-year scholar in the Charlotte Area Health Educators Center AHEC program, where she has been trained in the delivery of interprofessional care and the needs of underserved populations. She completed an internship at Preferred Medical Marketing Corporation as a business intelligence intern. Justine is interested in healthcare operations. After receiving an MHA from UNC Charlotte in May 2021, Justine plans to pursue a career in hospital administration. Nastasia McCoy earned a Bachelor of Science in Public Health with a concentration in community health from East Carolina University, where she served as the Community Outreach Chair and Secretary for the Black Student Union, as well as the Secretary and first Vice President of the Lambda Mu chapter of Zeta Phi Beta sorority. Nastasia also completed internships with the Wellness Center at East Carolina University and the Association of Mexicans in North Carolina. During her graduate studies at UNC Charlotte, Nastasia also completed an internship with the National Association of Health Service Executives and a second internship at Novant Health working in the supply chain department. Nastasia will receive an MHA from UNC Charlotte in May of 2021. Austin Smith received his Bachelor of Science degree in Sustainable Development at Appalachian State University with a focus in ethics and communication. Austin has a history and background of community enrichment and service-oriented work and spent 5 years working in the nonprofit sector. Austin completed his graduate internship at Atrium Health Levine Cancer Institute. During his internship, he worked with Health Disparities in Outreach Department, where he worked on the implementation of a cancer screening initiative focused on the LGBTQ population in Charlotte, North Carolina. After receiving an MHA from UNC Charlotte in May of 2021, Austin hopes to utilize his MHA degree to continue working in areas of community development and addressing health disparities. Savannah Valentine earned a Bachelor of Science in Health Systems Management from UNC Charlotte with a minor in Gerontology and Sociology. She served as the treasurer and president of the Gerontology Club or Honor Society at UNC Charlotte. Savannah began the Master of Health Administration program as an early entry student. She is completing a graduate certificate in gerontology in addition to the MHA. Savannah has worked as a graduate assistant for the Department of Public Health Sciences, where she helped to write and design the Health Systems Management newsletter published monthly. She has also assisted with an MSMT curriculum review and HSMT peer advising program. Savannah has completed several internships in long-term care settings, including one with Lincoln County Senior Services. Savannah seeks to improve the lives of older adults and plans to pursue a career in long-term care after receiving an MHA in May 2021. Brittany Weatherall received a Bachelor of Science in Health Education and Promotion, graduated from East Carolina University. Brittany authored an article published in the American Health Education Journal. She worked as an intern with North Carolina State University's North Carolina Cooperative Extension. Brittany completed a graduate internship with Atrium Health Levine Cancer Institute to expand access to life-saving mammography services for vulnerable populations in Mecklenburg County. She has a passion for helping the underserved community and enjoys mentoring and volunteering with underserved youth. Brittany's goal is to improve the care and communication provided to underserved communities through health promotion and education. After receiving an MHA from UNC Charlotte in May 2021, Brittany plans to pursue a career in nonprofit health administration to expand access to care and resources for African American women and children.
And now, MHA students, you are given a minute to express your aspirations for the future. And Allison will start.
Thank you. So my name is Allison Himmel, and sort of as stated in my bio, my interest is in patient outcomes and adverse effects. Patient perception of care and effects on long-term outcomes is an important facet of healthcare that can be sometimes overlooked in aiming to accomplish more concrete health outcomes. So my long-term goal is to pursue a career in human resources or quality control in order to help bridge this gap between perception of care and true patient care outcomes.
Sunaina?
Thank you, Dr. Platnova. I am honored to be inducted tonight along with my peers. And as I move forward in my career, I would like to be in a position where I can make a difference. A personal passion of mine is mental health. And I would like to build bridges to destigmatize mental health in minority communities, including the community that I am a part of. I know it'll be a long and hard process, but the way I see it is every step taken in the right direction towards destigmatization and mental health improvement is a step worth taking. Thank you.
Thank you. Nikki, go ahead.
Good evening, everyone. I aspire to work in healthcare management and development, quality, or community relations. Most importantly, I hope to utilize my education and professional experiences to build bridges to better population health by promoting a holistic definition of health and advocating for a more proactive healthcare model. Further, my goals include increasing access to care, improving quality of care, and utilizing evidence-based practices to improve health outcomes.
I believe I'm next, Dr. Platnova.
Sure.
Hi, everyone. I'm Justine. It is also an honor to be inducted into the Honor Society tonight, along with my classmates. I aspire to work in an operations role in the hospital setting or other healthcare facility. My main passion is to impact community health through effective management of staff and resources to bring quality care and services to the population and make sure that it is accessible to everyone, particularly underserved communities, and improving health outcomes that are sustainable is really important to me.
Thank you.
Hi, everyone. I'm Anastasia, and I want to say also thank you so much for considering me to be inducted tonight. My plans are to get a career in operations and eventually be the CEO of a large health system. Also would like to open mammogram buses, STD buses, and low-income clinics or clinics in low-income areas. Thank you.
Hello, everyone. Thank you. It's an honor to be a part of UPD, and I'm so grateful for being inducted with this group of classmates and alumni. Last summer, I had my internship in the field of health disparities, and I hope to continue that work in a similar capacity in the future. I believe this past year was a big wake-up call, and it illuminated just how much work there is to be done in closing the gap in our health system that so often fails those that need it the most. But I don't have a job lined up just yet. I don't necessarily know what my future holds. I do know that I want to be an active role in continuing the progress that needs to be made.
Thank you.
And I believe I'm next. So my name is Savannah, and like my peers, I'm honored to be inducted tonight. And I want to say congratulations to everyone else as well. So as I graduate in the next couple of days, I will continue to pursue a career in long-term care. I developed a passion for working with the older adult population pretty early on in my undergraduate career. And my ultimate goal is to serve as an executive director for a long-term care community or as a long-term care ombudsman in the Charlotte region. And occupying one of these roles will really allow me to use my leadership capabilities and the skills I've learned throughout the MHA program to improve the care older adults receive in residential care settings. And I want to say thanks again for considering me for UPD membership. I'm looking forward to a long and successful future in healthcare administration.
Thank you, Savannah. Thank you.
I guess I'm next. Firstly, I want to say thank you to my professors for nominating me for this amazing organization, as well as this great opportunity. Throughout my time in my collegiate career, I have done a number of assignments, projects, and presentations on my passion. I'm sure many of my classmates that are here are fully aware of this, and some might be tired of hearing it as well. But my commitment to building bridges to better population health is derived from my passion to improve access to care and advocating for those voices that aren't heard. I'm motivated to do this by uplifting voices that are often seen as vulnerable. I'm motivated to do this by advocating for those who can't advocate for themselves. And I'm motivated to do this through my efforts to build bridges to better population health. A brighter world is manifested where everyone has equal access to care and no one is subjected to health inequities. And no matter what I'm doing in that space, I'm always going to vow and commit to doing that.
Thank you. Thank you, Brittany. And now we will continue with the induction of our wonderful alumni. And Amanda Dees.
Yes. So I have Brandon Fowler first up. So Brandon Fowler received an MHA from UNC Charlotte in 2008. With 13 years of health management experience, Brandon has served in executive leadership positions in strategic planning for large healthcare organizations for the past 5 years. Brandon spent 12 years at Tenet Health in local hospitals and in San Antonio, Texas. Some of his major achievements include starting the STEM Emerging Heart Attack Program in South San Antonio and creating a diversity, equity, and inclusion strategy and a social impact strategy for Atrium Health. Currently, Brandon is Planning Director, Strategic Services at Atrium Health. Brandon is a member of the American College Healthcare Executives. His community service includes being a previous board member for both the South San Antonio Chamber of Commerce and the Harvey Najee YMCA. During the past year, Brandon has participated in several COVID initiatives, including volunteering at Atrium Health's mass vaccination events at Bank of America Stadium. Kenny Nguyen earned a BS in respiratory care from SUNY Upstate Medical University and an MHA from UNC Charlotte in 2012. He has served in leadership roles at leading academic medical centers such as Georgetown University Hospital, Yale New Haven Hospital, Wake Forest Baptist Health, and Atrium Health, where he currently serves as the Director of Respiratory Care. Kenny has experience leading teams of more than 300 employees while operating budgets up to $60 million with revenues up to $300 million. He also has experience in the areas of physician and researcher compensation and recruitment. Kenny has led clinical redesign teams to reduce all-cause hospital readmissions and reduce overall hospital length of stay. Kenny serves as a commissioner for the Commission on Accreditation of Respiratory Care. Kenny received his Dr. Helmholtz Annual Education Lecture Award in 2019 for his contributions to respiratory care education. Kenny also teaches at UNC Charlotte and Boise State University. Kendra Worthy graduated with a bachelor's in health systems management and minor in psychology from East Carolina University, where she earned the Outstanding Senior Award. Kendra received an MHA from UNC Charlotte and a graduate certificate in health informatics in 2018. Kendra also served at the Greater Charlotte Healthcare Executives Group as chair and is also a liaison to UNC Charlotte's MHA program, promoting GHEC and encouraging students to become involved to grow professionally. Kendra currently is a business manager in strategic operations central division at Atrium Health. She has been recognized as a key driver in leading staff operations for more than 2,000 employees during COVID-19 and managing other system level projects in response to the pandemic.
Thank you. And we would like to hear from our inducted alumni about their professional experience in healthcare management and their aspirations for the future. What inspires them to move? And Brandon is number one. We cannot hear you. Cannot hear you. Mm-mm. Okay, we will go to Kenny.
All right, wonderful. Thank you. This is just such an honor and a privilege to just be here. I mean, listening to the students and the accomplishments and the aspirations is just absolutely incredible. Just couldn't be more proud to be a part of UNC Charlotte and now this honor society. It's such a privilege. And, you know, from, building bridges to better population health, you know, I see this from a tangible perspective and an intangible perspective. And from the tangible side, what I see is really the work that I've done around all-cause readmissions related to either COPD, pneumonia, sepsis, and really trying to figure out how do we set up those patients for success and measuring that success through 30-day readmissions and even up to 90-day readmissions. The intangible side to building better community and population health is really the side where I mostly live in the operational world. So I have responsibility for employees that come through the organization and work for us and serve alongside with me, and really focusing on creating psychological safety and an environment where they can be comfortable and safe. For some of our employees, work may actually be the best place for them. And when you start to think about that, and you start to think about the benefits that you can offer from a workplace perspective and really the ripple effect back to the community for better health, it's going to happen. And it really, I'm motivated by that every day, and I see that every day. And that's really important to me, and that's a deep focus that I have. For aspirations, really developing an ecosystem in the post-acute world is really important to me, especially as we discharge our patients from the hospital. Again, I live in the hospital. And it's just, how can we build that ecosystem to move our patients forward through their progression of care and the life to a better quality. And really from a motivational perspective, hearing those patient stories, hearing my team talk about those patients and those stories. And I heard one today and it was just wonderful. A paramedic went, saw a patient, called back to the hospital to one of our navigators. They were able to set up this patient to go and receive some steroids and hopefully keeping that patient out of the hospital. And the one thing the patient said to the navigator was, "Thank you for caring so much." And you can't beat that when you hear that on a daily basis. And I hear it on a daily basis. And just grateful for, as we start to move through COVID, I had the opportunity to serve as a planning section chief for my hospital and the things that we learned. And I'm excited for taking those learnings and applying them into the future and hopefully not letting go of those and just moving forward for a better future. And again, just thank you for the opportunity to be here. I really appreciate it.
Thank you, Kenny.
Can you hear me now, Dr. Platnova?
Good.
Okay, I'm so sorry about that. And Kenny, I hate that I missed your entire experience, but I would love to catch up on it later. But I want to say good evening and many thanks to you, Dr. Platnova, and your UNCC MHA administration, and the Delta Omega chapter of Upsilon Phi Delta for this extreme honor. I'm truly humbled and honored to be a part of an organization that is committed to advancing healthcare and policy through service. As a healthcare leader, I'm inspired by marginalized populations that tend to have negative or adverse experiences or outcomes in our healthcare system. I understand that I must leverage my power, platform, and privilege to help elevate, educate, and inspire hope to these populations by reducing and eliminating healthcare disparities. I'm proud to say that I led HM's Health Social Impact Strategy last year, and that we are committed to improving the life expectancy of populations in our most vulnerable communities. We are addressing access, quality, social determinants of health, and acute social needs to help our strategy come to life. Again, many thanks for this admiration.
Thank you. Kendra?
Can you all hear me okay?
Kendra Worthy?
Yes, can you hear me okay? Hello?
We can hear you, but I can see only Justine Lyon.
I'm sorry, I could not get my camera to work for some reason, but I'll keep this brief. In healthcare, we practice the Japanese concept of Kaizen and but myself and everyone here today, we have learned grit, resilience, and bravery throughout the pandemic. These elements can be summarized by the Finnish concept of sisu. My aspirations is to continue practicing sisu in healthcare by continuing to transform healthcare through strategy, analytics, and meaningful conversation.
Thank you, Kendra. Thank you, Kendra. And now, in 2021, we are inducting one faculty member, Dr. Michael Thompson. Dr. Thompson is an associate professor and the associate chair of public health sciences. He directs UNC Charlotte's CHEMI accredited and nationally ranked Master of Health Administration program and is the acting director of the Academy for Population Health Innovation, a partnership between the university and Mecklenburg County Public Health Department. He has over 20 years experience in actively developing and leading accredited public health and healthcare administration programs domestically and internationally. Dr. Thompson earned his doctorate in public health in 2002, specializing in health services research and evaluation through the Department of Public Health, Policy and Management at the Johns Hopkins Bloomberg School of Public Health. His professional practice focuses on competency-based workforce development and assessment, as well as community-driven programmatic interventions. Past efforts include supporting public health and health administration programs development in the countries of Armenia, Saudi Arabia, Pakistan, and Lebanon, among other locations. Congratulations, Dr. Thompson. Please share your aspirations with us.
Thank you, Elena, and to the Chapter Advisory Council for this honor. I appreciate it. And I'm going to start with kind of a background that many of you may not know, is that I am a first-generation college student. I grew up on a family farm just outside of Annapolis, Maryland, and fortunately for me, an area that was transitioning from rural to urban and suburban. While there, I developed a strong work ethic and saw the interconnectedness of human and environmental health firsthand growing up on a farm. And also learned to value those tensions that we see in public health between self-reliance and interdependence. As I progressed through my career, my father always said, learn to use your head and not your back, that there wasn't a future in farming. And as a young adult, I began to realize in hindsight how fortunate I had been along the way as a first-generation student to have come in contact with so many role models and mentors that I didn't recognize as such, who helped push me along my career path. Like many people, I started out thinking about having a career in medicine. That quickly changed as I went through my college years and did some volunteer work in the emergency department about the need for more focus on health systems and how the healthcare delivery system was and wasn't working. And this was all the time that AIDS was emerging. So it was quite an exciting time to be thinking about these things. There, I went on to do master's work in emergency health services, and then started working towards my doctorate in public health by working on curriculum development. And that kind of set my career path. And that's led me to this blended approach of curriculum development, workforce development, and community engaged practice, bringing science and research to bear with communities to solve problems, not just doing research for research's sake. So that's led to that varied career that you heard speaking. I've been to this point more countries than states, 41 versus 35, and I've addressed this breadth of health problems doing public health practice, everything from food fortification, blindness prevention, hospital quality assurance, community health assessments, infant mortality, tobacco control, you name it. It's been one challenge after another based on the communities I was working with and assessing the needs that they most needed. And because of that, I believe very strongly that interconnectedness between education, workforce development, they're part of any systemic changes. If we're going to make long-term changes, we need to have those elements in place. And so I'm especially focused as a first-generation student in realizing so many of the obstacles that I had that my colleagues and peers didn't have, and how fortunate I was to kind of find my way through them with some timely help, that I really focus on expanding the opportunities and nurturing talent among the marginalized and disenfranchised, to give them the same opportunities and belief and support that I had. I believe that compassion, integrity, and humility are essential to successful collaborations with diverse communities. I believe restoring our larger sense of trust in community and rebalancing our sense of obligations to one another, reaffirming the social contract that is stretched right now, are key to improving both health at the individual and population levels, as well as our economic well-being. And so I believe I continue to best serve those aims by continuing to do what I do, and appreciate your recognition of that. Thank you.
Thank you. Thank you. Today, we are inducting one honorary member, Miss Gibby Harris, RN, MSPH, is the Health Director of Mecklenburg County. In this role, she manages, provides vision, and directs all public health and environmental health activity in Mecklenburg County. Ms. Harris earned her BSN and later her MSPH in Health Policy and Management from UNC Chapel Hill. Early on, she was challenged by the emerging HIV/AIDS epidemic. Her strategy of building community partnerships using analytics and open dialogue set the tone for her successful career. Prior to joining Mecklenburg County in 2017, Ms. Harris's 25-year public health career had included positions as health director for Wake and Buncombe counties. Along the way, she had managed the transitions of single county health departments into consolidated health and human services agencies. Her administrative excellence was recognized. In 2011, Ms. Harris was named North Carolina's Health Director of the Year. For the past 15 months, Ms. Harris has drawn on those experiences in ways she has never imagined. As the public face of Mecklenburg's pandemic response, she has provided brief, evidence-based, non-partisan guidance and a calming voice amid an ever-changing pandemic landscape. Congratulations, Ms. Harris. Welcome to share your experiences with us.
Good evening, everyone, and thank you so much for having me here tonight. I want to thank Dr. Warren, Dr. Thompson, as well as Dr. Platanova, I'm going to say your name wrong, for this honor. It truly is an honor that to be accepted into this, this group and to be part of both the alumni as well as the new inductees that I've heard about tonight. Such an incredible group of young people. Congratulations to all of you, and I really look forward to see what you accomplish over the next years as you move forward. So, you know, one of the things they've asked me to talk a little bit about the building bridges to better population health and some of the things that I've learned over the years. And I guess, you know, I listened to Michael. I shouldn't have gone after him because we both think a lot alike in terms of some of the things that we think are most important. But a couple of things that I will say is, you know, as you know, I am a nurse. I started as a nurse. I worked in a hospital for a couple of years, decided that was not my cup of tea. I went back and became a nurse practitioner. I ran a rural health clinic for a couple of years, enjoyed that and being more involved in the community, but then had an opportunity to start a hospice program in North Carolina. Started the hospice program and ran that for 8 years. Actually, I was the first employee, so I did a little bit of everything. And so there was a lot of home visiting, a lot of opportunity to work with families, not just individual patients, a lot of opportunity to see all of the different issues that impact families and how that influences their health and the way that they respond to their health and to their community in general. And actually ended up being the director of that organization. We built the first freestanding inpatient facility in the state and realized at one point that I was sort of managing by the seat of my pants. I really did not have a lot of education in management and thought that it might be helpful if I learned a little bit more about that. The other thing that drove that is we had our first HIV patient. And this young man died a couple of weeks after he came back from New York, where he had become HIV positive. He came home to die with his family. And I realized I was tired of seeing people die from diseases that were preventable. And so public health just seemed like a good fit for me. It helped me with the whole administrative management side, but also the policy side, as well as the prevention side of disease. And so I got into public health and, you know, so I came at it in a much slower way than most of you have. And it has been my passion ever since. I want to mention the fact that I understand that access to healthcare, good healthcare for everyone, is critical to the health of our population. But I also want to recognize that public health is a system. Hospitals, healthcare is part of that system, but it is only part of that system. And all of the other things that impact health have to be part of that system, and it has to be tied together in a way that provides the support for our families and all of those individuals in our community to make sure that they are able to be as healthy as they can be. That's how they're going to be productive. That's how they're going to be able to raise their children. They need to be able to get the education they need. All of those things impact their health. So for me, I'm going to put a shameless plug for public health in here. Local public health is sort of the hub of that public health system. And if that hasn't been apparent over the past 15 months, it's never going to be apparent. As public health has been involved in the implementation of all the different responses to COVID. But I've got to tell you, I'm also involved in the issues around employment and the issues of how we get people back into work and how we make sure that our children get back into school and the fact that people don't have the transportation they need. So it's just a big picture that we in public health have to continue to keep in our minds. And the other part of that is the whole issue of health equity has to be a lay over all of that if we're going to be successful in helping our communities be effective for everyone in our community. So I recognize that most of y'all are looking at hospital systems to work in, and I appreciate that and I applaud that. But as you can see, I started in healthcare and sort of moved into the local public health arena. I actually worked at the state for a couple of years in HIV in the early days, and recognized fairly quickly that I preferred working in the community, number one. Back in those days, I couldn't get much done around HIV because of the politics of it, and came back to the local level to work. So, you know, I just want you to think of the work that you're doing, and several, especially of the alumni, talked about the impact of the other things in the community on the people that they're serving and what they're sending people back to when they leave their hospital systems. And think about how you can affect that, whether you're working in a hospital system or whether you're working in the community itself. One thing that I will recommend to you as you move into your careers is, regardless of where you work, that you find opportunities to work in your community on the ground. There is nothing more educational than being boots on the ground and working with the community. You need to be a leader, but you also, part of being a leader is being willing to be led. And quite often being led by your community is what's going to help you understand what they need. And we have a bad habit, have had for years, of thinking that we know what our communities need and telling them, giving them what we think they need. The reality is, and I learned this at the knee of Lucille Webb in Wake County, an African-American woman who had been a teacher and was doing community work, who took me by the hand and said, "You're screwing up. You need to pay attention to the community. You need to listen to what they're saying to you, and you need to give them what they need before they can hear what you think they need." So all of those things have been learnings for me and have served me well as I've attempted to work in the community. A couple of other points that I'll make, just from what I have learned and what may be helpful to you as you move forward. Number one, always learn. You're never too old to learn. I learn new things from my staff, from my community, from many people every day. And so that is critically important. And the other part is be ethical and honest. Never hesitate to say, "I don't know," and just be as honest as you can be. Trust is, there's nothing more important than trust. Michael mentioned that as well. If we don't have trust with the people that we work for and with, then we can't be effective in the work that we do. The other thing that I will say is be willing to take chances. You know, I started out as a nurse. I was going to be a nurse my entire life. I came from a healthcare family, knew that that's what I was going to do. And I listened to my heart. It was not what I wanted to do, to be a nurse in a hospital, not long-term. And so be willing to take those chances, because it opens up new opportunities to you that you may not have thought of as something that you'd be interested to do. And get comfortable with change, folks. If you're not comfortable with change, you're going to be miserable, because that is one of they talk about death and taxes. Well, change is one of those things that's inevitable as well. And so just get comfortable with it and learn how to adapt to change and help the people around you adapt to change. The other thing that I will say, the couple of last things, just learnings that have been important to me. I mean, there are books and articles about leadership roles and what's important in leadership. And I'm not going to try to list all the different things that the people who have studied leadership say. The things that have been important to me is to be true to my values, know what they are, and be true to them in the work that I do. Be engaged in your profession. You need to give back. When you have the opportunity to work with a student or with someone else to help them grow in their profession, make sure that you're doing that. Self-care is critical. You need to take care of yourself. You can't take care of other people if you're not taking care of yourself. If we haven't learned that through COVID, we're not going to. I have had to push my staff, who are so passionate about their work, that they won't take a day off because they're afraid something's going to go wrong, and nobody's indispensable. You need to take care of yourself. And lastly, if you don't do anything else, keep your sense of humor. That is critical to life in general. So be willing to laugh at yourself. I do that almost on a daily basis because I have a bad habit of doing something like muting myself when I'm not supposed to, or something else. Be willing to laugh at yourself, but also keep that sense of humor with others that you work with and that you play with and that you work for, because that sense of humor will help you get through the day. So I have talked enough. I am very grateful again for this recognition. The point that I try to make is that whether you work in the healthcare system or in public health or wherever you work, it's a team effort. You don't work by yourself, you work with others. And so I accept this award, but I accept it on the behalf of all the people in my department that I've worked with and all of the people in public health that I work with, because they're all champions as far as I'm concerned. Thank you again.
Thank you, Ms. Harris. Thank you. And now, Dr. Thompson.
Yes. Thank you, Gibby, for those sage words gleaned from your experience and your passion. I think they will serve our students well. And you've kind of highlighted something we kind of brag about to our students, that one of the values of an MHA program that's based in a school or program in public health is that you do get exposed to this public health values, that population health thinking that we're now seeing becoming even more important within what were traditional clinical care systems, with the focus on community benefit and population catchment areas of hospitals, that we're seeing this as a value add to our students, even without their formal training in public health. We've already started the initial inoculation of indoctrination into the public health way of thinking. And that really has served them well. That along with the systems thinking that you stress so much, and the equity lens that we now seeing being talked about as the county sets its next budget. I'm closing back on one of the first things you mentioned about the importance of listening to and being engaged with your community. And that serves into the kind of the final presentation we have this evening, which is the Richard Martin Service Award. The Richard Martin Service Award honors the spirit and memory of our 2014 MHA graduate and UPND inductee, Richard Martin. We were heartbroken to lose Richard in 2015, only a few months after he'd ended his administrative fellowship with Novant Health Early to take on a permanent position there overseeing 5 express care clinics. His career and personal life were just taking off, and his plans for reaching back to help others follow in his steps were just taking shape. Borrowing from the words of his family, Richard was an exceptional person and student. He never turned down the opportunity to expand his horizons or experience new things. He was always willing to help and mentor anyone who may have been in need. Even after his passing, he is still being recognized for all the lives he has touched. That tribute reflects the Richard Martin we knew as a student and engaged alumnus. Richard always had a smile on his face and an openness to help and to serve. With this award, the MHA faculty recognize a student inductee tonight for striving to excel and to help others to achieve their best as Richard did. The award comes with the family's prayer that the recipient is blessed beyond measure and continues to honor Richard's legacy of service. Upon the recommendation of the MHA Program Committee faculty, this year the recipient of the Richard Martin Service Award is Justine Lyon, whom we've recently heard so many wonderful things about and from. So this award comes as a surprise, and so I'm going to invite Justine on the cuff to say another few words, if she would, of acceptance of this honor.
Definitely comes as a surprise. I would just like to say thank you, first of all, to the faculty and staff of the program, again, Dr. Thompson and Dr. Platinova. I absolutely was not expecting this, but I guess the words I would like to say, I really enjoyed my time here at UNC Charlotte the past 2 years. I've grown a lot in leadership, in learning the healthcare system as a whole, tangible things that I'll be able to use for my next steps, but then also just those soft skills. I've enjoyed working with my cohort. They are a great group of people and have definitely helped me look good on various projects all throughout the past 2 years. So I just want to say thank you, and I'm humbled by it.
Thank you, Justine. Thank you. Now, I would like congratulate everyone who was inducted today, our wonderful MHA students, our wonderful alumni, our wonderful faculty member, and our wonderful honorary inductee. Thank you also for the UPD advisory board. It's so nice to see your faces. You look fantastic and you're supporting this organization. Of course, congratulations to Justine once again. Thank you, congratulations. And thank you also to everyone. I cannot even put a list of names, those who helped to develop, to prepare, and to manage this induction. Thank you so much.
Let me also add my thanks. It's been wonderful to hear of our students' aspirations, our alumni accomplishments, and the journeys of some of our leaders. My best wishes for all of your continued success. And I hope you take time to celebrate this honor, and for those of you who are graduating, to enjoy commencement. And good evening.